Let me give you another quick example of what we're doing with IKNOW in the healthcare setting. In healthcare, electronic medical records, there is a vast amount of data that is included in those records in free text form. Observations by nurses, observations by doctors, interpretations of x-rays or lab results. One of the things that we're building now in TrackAir is, as a note is being created, we can search for similar notes, similar incidents in the unstructured data when a patient came in with similar symptoms 3 years before, 4 years before, or the like. We can search across multiple populations to see where other patients presented similar situations, and then have the physician look at the course of treatment that was followed there and have a more informed decision about what they do. We're pretty excited about using this technology in our applications, and we think you will too. But this power goes even further. You've heard us speak about Deep Sea, you've heard me talk about it again today, and you know that the benefits that we offer there of embedded real-time business intelligence. But think about it for a second. What happens if you marry the IKNOW technology with the Deep Sea technology? And now you can start to apply some of that capability, not just to the structured data driving KPIs, but also begin to extract information from unstructured data. And in many respects, this is probably the most exciting avenue that's opened up for us and for you with our introduction of IKNOW. Those are some of the key technical things that we're doing in our core technology this year. I want to touch very briefly on what we're doing in healthcare. With TrackAir, it's an extraordinarily global HIS. It's being deployed in 25 different countries. It works for primary care settings, it works for small clinics, it works for large hospitals. And our focus this year is on improving the workflow for clinicians, in using Deep Sea within TrackAir to get better business intelligence used within the decision-making process of providing health, of managing a hospital. One of the key elements in healthcare that's important is when shifts change, when the day nurses leave and the night nurses come in, when one physician leaves, another physician takes over. Those clinical handovers are one of the most common places where mistakes happen in care. And we are building tools in TrackAir this year to make that process, to put more of a focus on that process that happens 2 or 3 times in a hospital every day for every patient, and provide better continuity of care, better transfer of information, so that when a nurse arrives, he or she can rapidly scan and get an update on what's happened since she left 18 hours previously. Our other healthcare product is HealthShare. As I mentioned earlier, this is a system for exchange of electronic medical records securely and with full consent and full auditing across an entire nation if need be. HealthShare is being deployed at sort of city-level deployments, at state-level deployments, at country-level deployments, and we're very pleased with what's happened there. But we're seeing a new trend emerging, and one of the things I want to announce today is that we're making components of HealthShare available to help support that. As governments, whether they're city governments or state governments or national governments, as they impose requirements on hospitals, on doctors, on laboratories to exchange information, those organizations, that hospital, has to develop technology to make that available securely, to make that available subject to the protocols that are established internationally under IHE. And what we're doing is we are partitioning HealthShare and making some of those underlying components supporting medical record exchange available as a technology platform for hospitals, for hospital chains, for physician groups, for laboratories, so that they can meet their obligations in public mandates, in public healthcare mandates, in information sharing mandates. And to give a simple example, in a hospital, if there's an increase in patient rates showing up with flu-like symptoms, hospitals need to detect that immediately, no matter where those patients are showing up. And they need to report that to the state or to the national level immediately, because it might be an early indicator of an H1N1 outbreak or some other flu-like disease. So they need access to the same kind of technology. And that's what we call HealthShare Foundation. And layered on top of HealthShare Foundation, InterSystems, or partners, or the hospitals themselves will build tools for provider registries, will build tools to compare and exchange terminology, will build tools for consent management. And I think HealthShare Foundation is going to be an interesting platform, perhaps for many of you. I've talked so far today about InterSystems and our products. I've talked about the trends in technology, trends in expectations and business that are affecting us, InterSystems, and you as technology providers. I've talked a little bit about what we're doing to help you take advantage of those from a technology point of view. Now let me shift a little bit and talk about what we're doing as a partner to make this possible for you. There are a couple of steps that we're taking outside our products that I think will be of significant benefit to all of our partners worldwide. The first of these is a new source of information, a new way of interacting with InterSystems and with other partners to take the best possible advantage of our technologies, to share your successes, to learn from what others have been successful with, or to avoid mistakes that they've made. We call this the Developer Connection. It will be a new portal that we will make available worldwide. And it's really intended to give you a new continuous avenue of interacting with us and gaining the maximum advantage from Cache, from Ensemble, from different components of our technology that we introduce, like INO or Deep Sea, over time. We've been building small communities, and those have been quite successful, but this is a much larger undertaking for us. And we're really looking forward to giving sort of a new dimension to information sharing around successful development and deployment of breakthrough applications.